Hi, Dr. Jim Jamison with Youngstown Orthopaedics here today to talk with you about another topic in joint replacement surgery. Today we're going to talk about figuring out what really matters for a successful joint replacement. Millions of people are affected by hip and knee arthritis, and hip and knee replacements are some of the most commonly performed procedures in the U.S. and around the world. These procedures are now routine and are very highly successful in helping patients return to their previous active and productive lives. Because these are such commonly performed operations, there's a lot of research that goes into new implants and techniques trying to improve patient outcome and the patient experience. As a result of that, there's a lot of advertisement by the implant companies. What's the best implant? What's the latest and best technology? What gives the least pain? What helps give the quickest recovery? We see advertisements in the newspaper, TV infomercials and TV stories, links online, every advertising medium you can imagine. So how do you sort out what really is important and what really matters? Let's talk about a few of these topics. Implants. Implants are the actual metal and plastic components that are put into your hip or knee. They're all acceptable for use in the United States, but what really matters is that you're comfortable with your surgeon and that your surgeon is comfortable using whatever it is that they're using. You as the patient is really not going to know the difference between one company's implant versus another's. Technology. There are always constant attempts to improve the whole experience and improve outcomes with new technology in orthopedic surgery. However, no one new device or technique by itself makes a significant difference. I've been involved in orthopedic surgery for 30 years, and I've seen a lot of new things come, and I've seen most go as well. It's important for me to be informed, to evaluate all the new information, new techniques, implants, etc., and to choose what is best for my patients. The approach to the joint. This applies mostly to hip replacements. There's a lot of advertisements about one approach being better than another. I've tried all the different approaches, the anterior approach to the hip, 2-incision hip, minimal incision, and all those alleged new developments, have not found any of them to be any better or help patients recover any more quickly or with less complications than my standard approach. So what really does matter? Pain management is very important. We use nerve blocks, spinal anesthesia. We try to minimize narcotics to avoid problems like nausea and dizziness and other complications after surgery, but still keeping patients comfortable enough they can get up and get moving quickly. Patient preparation is key. Patient being informed about the process they're going to experience, what the recovery is going to be like, every step along the way. An informed patient makes for a very happy outcome. The patient alone is probably the biggest factor. All my patients get the same preoperative preparation discussion, the same materials to review. They get the same surgeon. However, recoveries can vary widely. Patients have different tolerance for pain. They have other impact from other medical problems and other things that might happen during their surgery. Also, patients' level of motivation varies widely. All these factors are important to consider. At Youngstown Orthopaedics, my partners and I do everything we can to make your experience the best it possibly can be. Come and see me and we'll talk about your hip and knee arthritis. Thanks very much. This is Jim Jamison with Youngstown Orthopaedics.